Welcome to Stream of Conscience, brought to you by Democracy for America, Fairfield County, where we believe that change is possible and you can make it happen. I'm your host, John Hartwell. Our guest today is Madaline Winkles. Madaline lives in New Canaan, is a breast cancer survivor, and volunteers with the Greenwich chapter of the Breast Cancer Alliance, the fourth largest funder of breast cancer research in the United States. The BCA believes in promoting breast health through education and community outreach. As a local activist, Madaline has worked to understand the Affordable Care Act, also known as ObamaCare. She's here to talk about several provisions that ordinary people are already benefiting from, well before the implementation of most of the bill in 2014. Madaline, welcome to Stream of Conscience.
Thank you, John. It's a pleasure to be here.
So, Madaline, you are a breast cancer survivor. And from that experience, you became more interested, I think, in the healthcare industry overall. And more recently, the Affordable Care Act was passed, also called ObamaCare. Mm-hmm. And you've been concerned that many provisions of ObamaCare are not really understood by the population as a whole.
Yes, that is correct.
So how did you get into this? Tell me about getting started in.
Well, actually, there were three different circumstances that led me to become more involved in trying to understand the Affordable Care Act. The first was my own situation with having a pre-existing condition. That was about 12 years ago, and it was the first time after, I was ill. I was looking for health insurance, and I had to enter into the individual market for the first time. Okay. And found out that although I could not be denied insurance because we did have the HIPAA Title I law has been passed, which states that I couldn't be denied insurance. Right. Unfortunately, the law doesn't have the mandates that require that you really would get proper insurance. And so I found that the insurance would be very expensive and that the pre-existing condition wouldn't be covered. So basically, it was worthless. It was extremely frightening, and fortunately, I was able to get into a group plan and be employed, and that's been okay. But it left me wondering, what about all those millions of people that are still unable to get insurance? Right. The second thing happened only a few, maybe 6-7 months ago, and that was when I was asked to take a basic healthcare online course to evaluate it. My husband was doing a project, and he wanted someone who really didn't know much about insurance at all, health insurance at all. And so I said, fine, I would do it. The course is by a professional trade association, and so at first, I'm looking at him saying, this is a little bit dry, but then all of a sudden it started becoming alive to me. And the really interesting thing was that it was I was learning about insurance from the insurance industry. And coincidentally, at the same time as I was doing this course, the movement to overturn the Affordable Care Act was going on, calling it unconstitutional. So that really piqued my interest even more. I was for the Affordable Care Act because I basically felt that it would be a good thing, but I didn't have any concrete reasons to be supporting it. The course taught me, I think out of the many things the course taught me, the most important thing was two fundamentals by which the insurance companies like to run their businesses and be viable. And that is spreading risk, can lower costs, and they have a little rule that if you give the right care at the right time in the right place, you're able to do that. You're able to low cost. They have this quality triangle called quality, access, and pricing. And when I started looking at the Affordable Care Act, I started saying, gee, this seems to kind of support what the industry is talking about.
And we know that President Obama, at the beginning of the negotiations for what became the Affordable Care Act, worked very closely with the insurance industry to try to bring them on board. Yeah. And when you say spread the risk, exactly what are we talking about here? How do we spread the risk?
Well, spreading the risk is having everybody insured. Right. So that you are insuring not only sick people, but well people also, because everybody eventually is going to need health insurance. And though you may not be using it, when I was in my 20s, I maybe didn't use it as much as I'm using it now. In fact, another thing that I learned through through this course is they have an 80-20 kind of rule, is not exactly the right word, but they know that at any given time, 20% of the population are incurring the largest amount of costs. You know, so out of the 100, 20% are incurring the costs, 80% aren't. So they need those other 80% to be funding to be able to make the insurance affordable for everyone.
Right.
Well, this absolutely just falls right into the category of the individual mandate. I mean, it just seemed so simple and made so much sense.
Right. Well, and as you may know, the individual mandate was actually suggested originally by very conservative economists back in the early days of the Clinton administration, because they were fighting against what the Clinton people wanted to do at that time with health care, which was to require that all companies provide it. And so the conservative think tank said, no, we should make this an individual mandate so that everyone is involved, and that would make that would spread the risk.
Right.
And of course now, in the individual mandate on the right is seen as you know, being unconstitutional and telling people that they have to, you know, buy a product.
Well, that was one of the things that really started prompting me to become more knowledgeable, and I am by no means an expert on this act, I'm not, but I just felt like there was so much about this act, so many benefits and services that, I wanted to know what they were.
Yeah.
And
how did you do that? Because I think it's very important that each of us is able to go out and look for information on our own rather than simply being fed it by, you know, the nightly news or, you know, talk shows on radio or television.
Absolutely. Well, what I did was I just started Googling. I started going online and looking at a variety of websites. Initially, healthcare.gov was, you know, my main source, and you know, everybody was so afraid of, you know, the bill has so many pages and it's so complicated, and it's a very wide scope bill, but there are you can learn about the basic benefits and services quite easily. They're delineated very well and into different sectors, demographic sectors. It's really quite interesting. And so I started looking at that information because you know, I was driven by a couple of things in that regard also. My husband and I had attended some of the healthcare community meetings that had been held before the bill was passed, and they were absolutely horrifying. I mean,
these are the ones that the Congressman Himes was
Yes, poor Congressman Himes. I mean, the man is a saint. I can't believe, you know, how patient he was. I mean, we can disagree about things, but the venom and hatred and that was there was unbelievable. We sat there and just couldn't believe it. So that kind of upset me. But then at that point, I still didn't really know too much about the Health Care Act. Then just things that were coming on into the news. I mean, it just seemed that there were so many distortions out there, so many emotional statements being made that that the intent of the bill was not even visible anymore. Right. That coupled with the fact that I know that anything of this magnitude, I mean, generally people do not like change. And so they're going to be a little bit, you know, frightened about it. They're going to have a lot of questions. They're going to be hesitant. That's understandable. They have a little, maybe, fear of too much government also. But so that between the distortions that partisan politics was playing and that, I just thought, I've got to really try and find out what this really is about. And so I started doing all of the, you know, Googling and doing research, and I was amazed at the things I was learning. Now, having had the insurance course really made a difference because it really, you know, I had the basis for knowing that ACA was going in the right direction. It was putting, you know, wanted to put our healthcare system in the right structure. So that was a tremendous help. And anyway, as I started finding out all these things, within my own life, amongst people I know, I started actually seeing how they were starting to benefit from it.
So let's talk about some of those people that in your life are becoming exemplars of different parts of the bill.
Well, this summer, my best girlfriend and I were talking one day, and she said to me, gee, you know, I just got a check in the mail for $150. And I said, well, what was it for? And she said, I got it from my insurance company. So what was it for? And she said, well, apparently there's something to do with the Affordable Care Act.
Right.
And I quickly went back and looked, and I had come across this, but it really hadn't sunk in until it happened to somebody, really happened in the real life world. Mm-hmm. And what she had received was, I mean, in the ACA, when your insurance premium, only 80% of your premium has to go to your health care. Only 20% of it can be for administrative costs and for profits.
Right. So let's just think about that for a moment, because a moment ago when you mentioned, and from the industry's point of view, their 80-20 rule, which was that,
right,
you know, 20% of the people are responsible for 80% of the costs.
Right.
And that's absolutely true. And we know that that works across a lot of different industries and a lot of different points of life. But what the Affordable Care Act did was say, okay, you're going to have to, as an insurance company, you need to spend 80% of the premium dollars
right,
that you take in on actual health care, and you can't be reserving that for administrative costs or for profit.
Right.
And so your friend actually received a rebate from her insurance company because they hadn't met the mark.
Exactly. And now my husband didn't receive it. I mean, she's actually the only person I know. Mm-hmm. But
which means that the other companies were
but that's right, they were in line.
They're in line.
And you know, over 12 million people by the end of the summer, I think into September, received over $1 billion as refunds. And when I was doing the research, I was amazed. Some of the states, the families were receiving $600. I think Vermont was one of the states. So it was
Let's just
quite
think
a
about
chunk
as
of money.
well for a moment, this 20% that the insurance companies are still allowed to keep, either for profit or for administrative costs. Right. When you compare their overhead with Medicare,
right,
the Medicare overhead is so much lower because it's a single-payer system.
Right.
Everybody sends their stuff to the federal government, and the federal government pays. So the overhead is very low. Right. There isn't a lot of marketing costs because the federal government doesn't have to spend money to right, market Medicare, whereas if you're a private insurer, you're spending money. That's part of your overhead is your marketing money. So I think that this is tremendous provision. And possibly in the future, we'd like to see it even lowered. Maybe, let's say, 85% goes
right,
to care.
Well, I think actually in some of the markets that may be true, because again, as I said, this, you know, it is a very detailed bill, and I do remember seeing 85% right, in some of the markets. But the other thing that came out when I took the insurance course is that seeing it from the industry's perspective, you know, they are in a difficult position sometimes. I mean, you know, costs are spiraling, and not through any fault of their own. I mean, we have advanced technology. People are using the services more. It is not necessarily, they're not exactly the boogeyman in the situation, and I think that's an important thing to know. And it is important to realize that they do want large pools of people, mm-hmm, you know, where risk can be spread. I mean, that's how they do business the best.
And the Affordable Care Act is going to provide the insurance companies with another 30 million customers
right,
every year.
That's right.
And those customers are going to be either paying themselves or receiving subsidies from the federal government, but the money is going to go to the insurance companies. So they must be very happy. Oh,
they are, and the system will just work better. I even called someone I know who works at a hospital, who's an administrator, and looking more into the data. I mean, right now, the way our system you know, works, when an uninsured person goes into an emergency room for an earache, you know, it costs the hospital and it costs us, mm-hmm, because those unpaid dollars are coming back, unreimbursed dollars are coming back to us. What would $800 now, you know, when they're insured, they can go to a doctor and it'll cost them a fraction of what it would have cost. I mean, in 2010 and 11, Greenwich Hospital alone lost over $9 million worth, you know, of funds that were uncovered, and Bridgeport Hospital was over $16 million. Right. I mean, that is totally unnecessary, and the hospitals are eager, you know, to be able to provide emergency room care for emergencies, just what it should be.
Right.
Right now, I mean, we're using our highest paid source of highest cost source of delivery for things that shouldn't be there at all.
Right, and Governor Romney the other day was saying, well, if we do provide health care, we provide it in emergency rooms if people get sick. But think about this for a moment.
Gosh.
You were a breast cancer survivor. Did you go on chemo?
Yes.
They don't do that in emergency rooms.
No.
There are lots of things that are not done in emergency rooms that would need to be done in order to keep people healthy. And keeping people healthy is much cheaper than allowing them to get sick and then trying to treat them.
That's another thing that I learned, that the experts in the field say that for every $1 spent in prevention, you save $10 in care. Right. And just to mention, until 2014, when the pre-existing condition pre-existing problem goes away for adults, the Obama administration has set up a high-risk pool program to help people who need chemotherapy, things of that sort now.
As a bridge now.
As a bridge. It's just a temporary until the 2014 law goes into effect.
Right.
But getting back to people that I know that actually, there was my friend receiving that check, and then I very shortly after hear of another friend who has explained that she has just been diagnosed with early stage breast cancer, but the good thing is, because of her employer, she was told that she had to go for the preventive care that was being now provided, and she did, and she hadn't been going for preventive care for 8 or 9 years. Wow. And so had she not done this, she might, have waited another year or two, who knows. Right. But now, now she'll be able to get treatment as soon as possible, and that's really, really important.
Especially in cases like cancer.
Exactly. Yeah. Very much so.
Well, so as you look around the political landscape today, we have people running for president, we have a U.S. Senate race going on here in Connecticut. We have in this 4th Congressional District a congressional race as well. All of those races have to do with federal policy on health care, which is what ObamaCare is all about, the Affordable Care Act. And so as you look at the political landscape, what do you see?
There are many that are against the Affordable Care Act, and I really don't understand it, because I think one of the biggest problems that's occurred with all the distortions and the lies out there and is that it's preventing us from really looking at the bill. I mean, the bill's not perfect. The bill, that was the other thing I've started learning. There are many areas that need improvement. There are many areas that will have to be tweaked, and there are many areas that have to be added. But it fundamentally is the right and sound thing for us to do. And by having all the distortions, it's preventing us from looking at it in a clear way and making it better. And the politicians that are against it, I feel, are just spewing out their own, rhetoric in terms of, I don't know, maybe they really believe it, but I find it hard to believe because, as I said, it's so basic. That it's the way the insurance company works best, that ACA supports that. I find it hard to believe that anybody cannot see that.
Well, so Governor Romney, of course, pioneered a very similar approach when he was the governor of Massachusetts, and he was a Republican governor working with a very Democratic legislature, and they passed the Massachusetts Act, which has been in place now for several years. And I think people in Massachusetts are very, very happy with it. It's, and they need to figure out ways to save money on it, but still, they're well over 90%, 97% of the people in the state are covered with health insurance now, and that's working really well. Throughout the primaries, Governor Romney was saying that the very first thing he was going to do would be repeal Obamacare on day number 1. Well, of course, he can't repeal it. It's a law. It was passed by Congress. It'd have to go back through Congress to get repealed. But there are things that he could do that would undermine it. And then a week or so ago, I saw him on
one of the talk shows?
One of the talk shows, on Sunday talk shows. And he said, well, we're not going to get rid of all of it. We're just going to replace it with something better, but he hasn't said what. How does that make you feel? Well,
it made me feel actually very mad. And as I'm slowly learning about the ACA, I immediately went back and looked more carefully at the pre-existing condition, because that's what he was focusing on. And it made me mad, when I eventually realized what was happening, because he was making it sound like he was going to adopt what ObamaCare is in terms of pre-existing condition. And then when I looked up, statements that he had made in different articles, what he was saying was absolutely not the same thing, but he was sort of, wanted to kind of make it look like he was. At least that's what it sounds like. I don't know. But in reality, what he was saying is basically what we have now. And that would be what HIPAA Title I gave us, which was it would be illegal not to give someone with a pre-existing condition insurance, but there would be no requirements or restrictions about how much they could charge or what they would cover. So basically, what he was saying is the same thing as what HIPAA Title I gave us.
Which we already have.
Which we already have, which we already know is not working. And so he also had something in there, you couldn't have a lapse of insurance, you wouldn't be qualified, which ACA, that is not the case at all.
And there's so many people who come in and out of the job market, and the only insurance that they have is through the job market.
Right.
And so if you're out of work for 6 months, you don't have health insurance.
Right.
And so therefore, under Governor Romney's approach, you wouldn't be covered. We've just got a few moments left. I want to talk quickly about the Breast Cancer Alliance and the work that it does and how people can support it.
Oh, the Breast Cancer Alliance is a wonderful organization which was started by one woman, now it's probably about 13 years ago, who had breast cancer. She and two of her friends sat around their kitchen table and they decided they were going to start raising money for breast cancer. And it's now, it makes well over $1 million just in its annual fashion show every October, which is coming up actually this October 25th. But the main thing about the Breast Cancer Alliance is it's got three-prong approach, and that is to educate women about breast cancer prevention, to provide outreach in local communities, so it's local in that sense, but on a national level it funds cutting-edge research for breast cancer prevention and cure. And most federal funding is usually for later stage breast cancer. So this makes it a very, very important organization, and it's just really wonderful. It's now growing. It had started in Greenwich, and I was actually the first person in New Canaan to be part of it. It's now in Darien, Connecticut, and now is moving into also Westchester County. Good. When I first started, the committee for the fundraiser, the main fundraiser, used to be about 40 women. It's now 150. The other important thing is that most of their funding, everything they earn, practically everything goes to where it's supposed to, because everybody is a volunteer except for one executive director, so they are able to keep their administrative costs lower than any of the other organizations around.
Well, it sounds terrific, and I'm glad you're involved in it. Thank you so much for coming in, talking to us today, and keep fighting.
Oh, well, thank you. It's my pleasure.
That's our show for this week. We hope you enjoyed it. You can find all our shows on YouTube by going to youtube.com/user/DFATVNet. We're also on Facebook and Twitter. Or you can send comments or suggestions for a show to info@dfa-tv.net. If you'd like to learn more about progressive political action, we meet at 7 p.m. on the first Wednesday of the month at the Silver Star Diner in Norwalk. We'd love to have you join us. Remember, change is possible, and you can make it happen. This has been Stream of Conscience, and I'm your host, John Hartwell. Thanks for watching.